Well, Cindi Gatton is back today. She's a private patient advocate who helps clients with serious health conditions navigate their journey on so many levels. So, good morning. Glad to have you back today.
Great to be here.
So, you've got a couple of stories for us about how to talk with your doctor about supplements and alternative medicines. So, tell us a little bit about Carter and Kevin.
Carter and Kevin are two clients that I had worked with that both had gotten very serious diagnoses. Carter was a gentleman that had been diagnosed with stage 4 pancreatic cancer, and he had not been real involved in his health care up to his diagnosis. He'd been generally pretty healthy.
And I would say, for our listeners, stage 4 pancreatic cancer is not a good diagnosis. It is a short window of time in most cases. So.
Indeed. And, I think for any patient who faces that kind of diagnosis, there's an overwhelming set of issues that they have to deal with. But one, of course, is getting sucked into a healthcare system where you get lots and lots and lots of information. And you also get pulled a little bit by family and friends that go out on the internet and find other things that may be touted
That's
as
right.
cures or other ways to help you.
The bane of a doctor's existence is the internet at times, though. I think we're getting used to it nowadays.
Indeed. And so, Carter was interesting because his oncologist was at a respected institution. They had given him a lot of information about the treatment that they wanted to propose for him. And when he contacted me, he didn't really know much about that treatment. He knew it was a lot of drugs, that he was going to have chemo and he was going to have this and that. Didn't really know the names of them. But what he did know was that his mother had sent him this email about a compound called Esiac-T, and that this was just guaranteed to cure his cancer. So we talked a little bit about how to research that, and more importantly, we talked about how to talk with his doctor about it. So when he went in to see his oncologist, he really was focused on this Esiac-T, and his oncologist basically told him very politely that if he wanted to pursue this treatment, that he did not feel that he could remain Carter's doctor, that he was going to need to refer him to someone else in the practice. And Carter was pretty surprised by that.
That is interesting that he would be surprised, but because as a doctor, I understand that statement, not that it's right, but when you add a new element into your treatment protocol that you're not familiar with, it could affect the outcome, and doctors aren't really comfortable with that. In fact, the area we're talking about is non-traditional medicine, referred to as complementary and alternative medicine, or CAM. And we're spending a lot of money, about $25 billion a year, on essentially dietary supplements alone. So how did it go after that conversation between Carter and his doctor?
Well, he decided that he did want to pursue treatment with another doctor in the practice. But what I found interesting is that when he saw the second oncologist and the oncologist asked him about supplements, he declined to, he wouldn't share that he was using anything. And by this point, he had found his Esiac-T online and he was using it. Now, I want to contrast that with a different patient story, someone else who also had a very difficult diagnosis. Kevin was another young adult, 42 years old, that had been diagnosed with stage 4 glioblastoma, which is another very difficult and challenging diagnosis. His approach was interestingly very different. He was not a medical person, but he and his wife dove in as though they were zealots to learn about this condition. They learned about the condition, they learned about all the treatments, and I'm sure you've probably experienced patients in your practice who still have a partnership with their doctor, but they're very knowledgeable.
Oh, absolutely. The best patient for me is the most informed patient, and a patient who knows their body. It makes it so much easier on me.
Yeah. Kevin had been a practitioner. I shouldn't say a practitioner. He wasn't delivering practice, but he partook of some complementary and alternative medicine. And just by way of defining, complementary medicine is medicine that's used in conjunction with Western medicine. Alternative medicine is when you opt for this in lieu of Western medical treatment. So
Very good.
He had used complementary kinds of techniques for his whole life. He used acupuncture. He went to see a Reiki practitioner, which is an energy kind of healing. And he also was very interested in food changes, dietary changes that he could make. So he'd done a lot of research, approached his oncologist about it. The oncologist was open to these practices, but in terms of the treatment, there wasn't a specific FDA-approved treatment. There were several. And Kevin found himself not sure that he really was in alignment with his physician about which Western treatment they were going to pursue. And so he sought a second opinion. He ultimately ended up with the second doctor. He felt this doctor maybe was better aligned with him philosophically. I think the real interesting thing about these two stories, though, are that Carter reported being very anxious while he was going through his treatment. He didn't know if side effects he was having were related to his SEACT.
And was afraid to talk about it.
He was afraid to talk about it. He'd made some dietary changes. Excuse me. He had been juicing and doing some other things, and he didn't know what the right dose was that he should be doing around that. And there's not a lot of good scientific information around that.
Once again, we're talking to Cindi Gatton. She's a private patient advocate. So what are the key elements in Carter and Kevin's experience?
I think there's several. One is that they were both open to talking with their doctors about the fact that they wanted to look at complementary and alternative medicine.
Good.
And I give them both big kudos for that.
Oh, absolutely. Especially to have a doctor tell you he's not going to take care of you.
Yeah, exactly.
if you do this.
Exactly. They also both had the experience of their physician not feeling really in alignment with their physicians when they first consulted them, and were willing to look at another physician to assume their care. And that, too, is an important part of being an empowered patient, whether you're kind
Absolutely.
of pushed there or whether you choose it yourself. And even though they both ended up with a different physician, they had very different approaches to their care. Kevin was pretty actively engaged and learning everything about it. Carter's approach was a lot more passive. And I think, the differences that had for them were that Carter was pretty anxious through a lot of his treatment. Kevin, I think, felt more in control over what was going on.
And so both had perceived different experiences. Do you think it was their personality that led them down this different routes, if you will? I mean, honestly, it's not the smartest thing in the world, I think, for Carter to say, well, I'm just going to take this supplement and I'm not going to tell my doctor. That's probably not a wise choice. But he felt that, that's what he had to do to get the treatment he needed.
I think some of that has to do with an individual's experience, as you pointed out, their personality, their experience with their life, but also with the healthcare system. People either embrace it, as Kevin did, and said, okay, this is what life dealt me. I'm gonna dig into this all the way. Carter, on the other hand, wasn't real comfortable with the healthcare system, and I think
it's a scary system.
It is. I think it presented a lot of challenges for him, but I think both would tell you that having a patient advocate helped them come to terms with whether it was their personality or whether it was their comfort with the system of being able to move a little bit more smoothly through it.
Well, so patient advocacy is you deliver it, has multi-levels. It's not just about the cost of health care and navigating those costs, but about empowering your clients to make educated decisions about their health care choices, regardless of the cost.
That's exactly right. I think one of the most important parts of patient advocacy is making sure that patients understand that they have choices. Sometimes the choice is to do nothing. But it's important to understand that there are many choices when we're facing these decisions, and the role of a patient advocate can be to help delineate what all those choices are.
And we're seeing a rise in, if you will, complementary and alternative medicine. And I think it's a great thing. In fact, some of the things that we consider part of Western medicine, like allergy therapy, is that. Just by chance, but it's integrated into what we call Western medicine now. So based on Carter and Kevin's experience, do you feel that the way that they went about this and ultimately their treatment is an alternative for a lot of your clients?
I really think that the important thing is to understand how you feel about the system and to make sure that the choices that you're making align with your values and your beliefs, but that you also feel empowered to share those with your physician and negotiate how you're going to go through your treatment together. That can be a little bit scary. It's a role where having a disinterested third party, if you want to call it that,
Right.
can be very helpful to
That could
negotiate
be
that conversation.
helpful. That's great. Well, how do people get in touch with you, Cindi?
If you want to just Google Georgia Patient Advocate, my name will come up, or you can go to www.cindygatton.com.
All right. Well, thanks for joining us once again. We look forward to talking to you soon. You're listening to Doc Talk with Dr. Jeffrey Gallops on Talk Radio 640 WGST.